Nice to see some familiar faces that took the day off yesterday. So good afternoon. Today we're here to provide an update on Massachusetts face coverings order and discuss further reopening plans. Since January, the Commonwealth's seen several positive trends in the public health metrics that we monitor with respect to COVID. Cases have fallen, hospitalizations have dropped, and we continue to be a national leader in administering and distributing vaccines. Yesterday, the Department of Public Health reported 812 new COVID-19 cases out of 42,169 tests, and over 21 million tests have been reported so far across the Commonwealth, making us one of the most significant test per capita states in the country. 625 individuals are in the hospital and 154 in the ICU. The 7-day average for percent positivity on COVID testing is 1.72%. With respect to vaccines, 5.7 million total doses have been administered in Massachusetts, and just under 2.4 million people have been fully vaccinated. Massachusetts remains number one in the nation in terms of first doses and total doses administered per capita among states that have more than 5 million people. And as of this week, we are number 2 in the nation among all states in terms of first doses per capita, which is a big statement about our ability to efficiently distribute vaccines and our residents' eagerness to get vaccinated. Our percentage of Black and Hispanic residents who have received at least one dose are both about double the national rate, and we are number 4 in the nation in terms of the percentage of Black residents who've received at least one dose here in Massachusetts. We've also been tremendously successful at ensuring that everyone gets a second dose. Over 99% of individuals who get a first dose get their second dose within the 42 days that are recommended by the CDC. Here in the Commonwealth, we've built a strong vaccine distribution infrastructure. We've stood up hundreds of sites, and we can take vaccines to meet people where they are. Recently published federal data shows that Massachusetts has the lowest rates of vaccine hesitancy in the country, with all of our counties showing hesitancy rates that are below 10%. Our national leadership on vaccinations has supported our ability to keep COVID in check as we safely reopened more parts of our economy. Over the past 2 months, we phased out travel restrictions and either eliminated or relaxed several COVID-related restrictions previously in place. All this progress toward getting people back to normal has been possible because of everyone's commitment to stop the spread of COVID and people lining up and getting a vaccine when it's their turn. Since March 22nd, when our last set of restrictions were lifted, the public health data has improved across the board. New daily cases have dropped by about 20%. The positivity rate of cases dropped by half a percentage point to 1.72%, one of the lowest levels we've seen since last summer. We're keeping up with ongoing COVID surveillance. We continue to test about 100,000 people a day, far exceeding testing in most other states. Over 21 million total tests have been administered here, and our state continues to be a top 4 player in terms of our total testing per capita. A large number of our population has been vaccinated, and we have the capacity, as I said many times before, to move to vaccinate many more people as federal supply increases. These trends remain important as we continue to move through our reopening plan and get back to normal. The progress on fighting COVID is key as we continue to reopen schools. Being in the classroom is the optimal place for our students to be to support their developmental developments. Public health experts and pediatricians agree that in-person learning with mitigation and the proper protocols is safe, and the experiences so many of our schools and their students, teachers, and staff have had here in the Commonwealth over the course of the past year make that abundantly clear. That's why we've been working with the Department of Elementary and Secondary Education to bring elementary and middle school students safely back to the classroom. And to support this transition, our administration's running the nation's first pooled testing program to test students, staff, and teachers. So far, positive test rates have been at or below 1%, meaning there's little to virtually no evidence of in-school transmission of COVID. Thanks to the testing, vaccines, and everyone's work to get COVID in check, Massachusetts high school students will be returning to in-person learning on May 17th. We believe it's critical to get all of our kids back with their teachers and their peers to learn and socialize and to have a chance in this very long and difficult year to be a kid. Today, we're also here to announce that because of the public health metrics have continued to improve, the Commonwealth will continue to the next steps of our reopening plan. Effective Monday, May 10th, the Commonwealth will reopen many outdoor Phase 2, many venues to Phase 4, Step 2 protocols. These will include amusement parks, theme parks, outdoor water parks, which can open and operate at a 50% capacity. Road races and other large outdoor organized group athletic events will also be permitted. Also effective May 10th, large venues such as indoor and outdoor stadiums, arenas, and ballparks will be permitted to increase capacity to 25%. This includes places like Fenway Park, Gillette, and TD Garden. Provided the public health trends continue, effective May 29th, the gathering limit will be increased to 200 people indoors and 250 people outdoors. Also effective May 29th, additional industries will be permitted to open and restaurant guidance rules will be updated. Lieutenant Governor will get into more details on these changes in just a minute. Finally, we anticipate that effective August 1st, all remaining industries will be permitted to open and all sectors will be able to operate at 100% capacity with all industry restrictions lifted. The Department of Public Health will also continue to issue guidance as needed, including guidance to still require masks indoors. We hope that with more vaccines and a continued success in stopping COVID, we can take this step earlier, but it will depend on everyone continuing to get vaccinated and doing the right things. I've also asked the Department of Public Health to relax the face coverings order when outside. Effective April 30th, face covering will only be required outside in public when it's not possible to socially distance or as may be required by sector-specific guidance, such as event guidance. Face coverings will remain required in all indoor public places. As we look ahead to getting back to something like normal, we'll continue to do everything that we can to continue to ramp up vaccinations, reopen the economy, and most importantly, keep everybody in Massachusetts safe. The light at the end of the tunnel, thanks to the hard work of so many, is getting closer, and we can start to look ahead with real optimism for the path forward. Last week, everyone 16 and older became eligible for a vaccine, and we urge everyone who's eligible to go get a shot. Doctors, nurses, and medical professionals everywhere have been emphatic about this. Vaccines are safe, and they are the best way to protect you and your loved ones from the virus. We know everyone's anxious to get back to normal, but we need everybody to step up when they're eligible and get vaccinated. With that, I want to turn it over to Lieutenant Governor, who'll talk a little more about the reopening stuff in detail as she continues to lead our effort there. Thank you.
Good afternoon, everyone. As Governor Baker said, on Monday, May 10th, we will open additional industries in Phase 4, Step 2. Almost a year ago, on May 18th, working with members of our Reopening Advisory Board, we announced our 4-phased plan to reopen the Massachusetts economy. Secretary Keneally co-chaired this effort with me. Thank you so much for your leadership and your continued leadership in helping us recover and rebound here in Massachusetts. We know how difficult this has been for all of our businesses all across our Commonwealth. We want to thank you for your hard work, your creativity, your ingenuity, and your perseverance to get through these very, very challenging times, and for working with us through the guidances and protocols to return your workers back into your workplaces and to safely return customers back into your businesses. Just thank you so very much. And as the Governor noted, the positive trends allow us to continue to do more relative to our reopening process, to lift more restrictions, and to see more of our economy reopen. As the governor also said, amusement parks, theme parks, and outdoor water parks, obviously this is a good time of year for that, will reopen at 50% capacity, effective on May 10th. They will be required to submit safety plans to the Department of Public Health. Road races and other large outdoor organized amateur or professional group athletic events will also take place with staggered starts required, and organizers will be required to submit safety plans to their local Board of Health or to the DPH, depending on the size of the events. These are really important. These organizations do an awful lot to help our nonprofits and our charities across our state. You can find more details about this on mass.gov/reopening. Youth and adult sports tournaments will be permitted for moderate and high-risk sports. Also effective May 10th, singing will be permitted indoors at performance venues and events, and there are strict requirements relative to this. You will be able to also find those at mass.gov/reopening. We are pleased that as the vaccination rates continue to rise, we can look forward to doing more. On May 29th, under the gatherings order, as the governor said, all gatherings will be allowed to increase to 200 people indoors and 250 outdoors in both public and private settings and event venues. We will be updating restaurant guidance and allow additional Phase 4 Step 2 industries to also open on May 29th. Street festivals, parades, and agricultural festivals will be permitted to open, and safety plans will need to be submitted to local boards of health to review. Bars, beer gardens, breweries, wineries, and distilleries will be permitted to open and will be subject to the restaurant rules. They will be required to operate with seated service only in a 90-minute limit, just like the restaurants. The restaurant guidance will be updated and will apply to both restaurants and those other establishments I just noted to no longer require food with alcohol service. Table party sizes will be increased to 10 on effective May 29th. Effective August 1, all remaining industries will be permitted to reopen, including dance clubs, nightclubs, indoor water parks. Industry restrictions will be lifted, including capacity increasing to 100% for all industries. The gatherings limit will be rescinded, and all industry-specific rules and guidances will be lifted, while businesses will be encouraged to continue just following best hygiene protocols, best practices. The Department of Public Health will continue to issue guidance as needed, including guidance still being required for indoor masking. As the governor mentioned, and this is something that all of you can help us with, it is our hope that if the public health data continues to trend in a positive direction and people continue to get vaccinated, plenty of appointments and places to go to get vaccinated, we will be able to take this step before August 1st. So everyone continue to do your part, and it's really critical that you stay connected to this process. This past year has been incredibly difficult for everyone. I do want to give a shout out to our friends in local government and our local boards of health who've done a tremendous job navigating all parts of our response to COVID. And we appreciate your continued support as we transition into this next phase, requiring your eyes and attention on safety plans that organizations present to you for processing. So thank you for your continued efforts on all fronts. I also just want to say an enormous thank you to all of you in business, large and small, downtown, main streets, wherever you are. We are so grateful for your ongoing efforts. And if we can continue to do our parts individually, get vaccinated, monitor hospitalizations and the rate of COVID, testing continues to be available for surveillance relative to the virus, we will be able to get to these next steps And I look forward to returning to what we love so much about Massachusetts, our communities, our downtowns, main streets, our coastline, our Berkshires, all parts of it, as we love it so much. Seeing it return to normal will be truly a wonderful moment for all of us. So thank you for everything that you're doing, and very pleased that we're at this point to make further reopening announcements. It's with my pleasure that I now introduce Secretary Keneally.
Thank you, Governor. Thank you, Lieutenant Governor. Grateful for our ongoing partnership on reopening. Over the last several weeks, I've been able to get out to a number of our communities around the state and talk with small business owners and community leaders. While they know we're not out of this yet, there's a clear sense of optimism that motivates all of us. And I think this is a great time to look at where we've been and where we're going with respect to support for our small businesses, downtowns, and commercial districts. Main Street businesses across the Commonwealth have done a great job navigating the pandemic. The state has worked hard to support their efforts through targeted investments like our grant program administered by the Mass Growth Capital Corporation. With another $30 million announced last week, we have now awarded direct cash support totaling $682 million to more than 15,000 small businesses. These grants have enabled many small companies to make it through the darkest days of the pandemic this past winter. About 45% of these grants have gone to women-owned businesses, while about 40% of the awards went to minority-owned companies. Through small business technical assistance grants and matching grants for community development corporations and financial institutions, or CDCs and CDFIs, we're investing a record amount of funding into these organizations that provide valuable training, assistance, and financing. Soon, MGCC will be rolling out 2 new funding opportunities focused on small business digital tools and crowdfunding. We will continue to be a committed partner for our businesses as we move through recovery and into resilience and growth. Many of our small businesses, especially our restaurants and independent retailers, operate in our downtowns. And over the last 10 months, the Shared Streets and Spaces program has awarded $26 million to help 161 cities and towns make changes to curbs, streets, and parking areas to support outdoor activity, dining, and commerce. Applications are being accepted again for this program to help our communities gear up for the summer. Thanks to funding provided by our local Rapid Recovery Planning Program, 125 cities and towns are now developing locally driven strategies to help commercial districts recover quickly. 15,000 businesses will be impacted by this work. Through our regional pilot program, 37 cities, towns, and nonprofits are now implementing recovery initiatives that address unique regional needs and opportunities, including supply chain resiliency, small business support networks, and regional marketing. And as we all start to think about trips and travel, I was excited last week to join the Lieutenant Governor in announcing substantial funding for our travel and tourism industry. These new grants, along with a new capital program, will support the ongoing My Local MA campaign, which encourages people to shop, dine, and visit locally, as well as make investments in the great destinations that draw people to Massachusetts. There were some very dark days over the last year, especially this past winter, but our economic recovery is taking hold. More businesses are reopening, outdoor dining is returning, and people are returning to work. Thank you, and now we'll turn it over to Secretary Sudders.
Governor, Lieutenant Governor, Secretary Keneally, good afternoon, everyone. An important tool in our ability to administer almost 6 million first doses across the Commonwealth is our network of vaccination channels, which have included an expanded number of regional collaboratives. These collaboratives combine the resources of healthcare providers and local health departments to create sites that can vaccinate thousands of residents on a weekly basis. Regional collaboratives create an additional option for our residents in order to access vaccines in a manner that's most comfortable to them. Over the past few weeks, we've been working with regional collaboratives to make it easier for residents to book appointments online. This week, 3 more collaboratives will be listed on our pre-registration system and will be live. Southern Worcester County, which includes 12 municipalities, Uxbridge, Northbridge, Mendon, Douglas, Bellingham, Blackstone, Hopedale, Millville, Milford, Oxford, Upton, and Sutton. The Bristol Regional Collaborative, which includes Fall River, Dighton, Berkeley, Somerset, Swansea, and Attleboro. And the Chicopee Regional Collaborative, which includes Chicopee, Granby, South Hadley, and Holyoke. That brings the total number of collaboratives on the pre-registration system to 11. Statewide, regional collaboratives and local health departments account for well over 600,000 doses administered to date. And as a reminder, you can pre-register for vaccinations by visiting the mass.gov webpage. Thank you. With that, I will turn it back to the governor.
Questions?
What went into that? What was the thought process into that?
I think basically we're trying to determine where we believe, if everything goes according to plan and everybody does the right thing with respect to getting vaccinated, and we continue to see positive progress on our case counts and our hospitalizations, we believe by then we can be in a point where we can move to more fully reopen. But obviously, some of this is going to be a function of continued performance on vaccinations and continued improvement on the healthcare metrics that have been such an important part of this since the beginning.
Is the pace of vaccinations going better than even you expected right now, and that's why you were able to kind of come up with that date and maybe even earlier?
I mean, we've been a national leader among all large states now for over a month, and we've more or less hit most of the marks that we established with respect to when we thought different parts of the Commonwealth would become eligible to get vaccinated. I think the big question we just don't know the answer to at this point is what's going to be going on with supply and what's going to be going on with respect to continued demand. So far in Massachusetts, for the most part, we've had at least as much demand as we've had supply, and in many cases had more demand than we've had supply. And that continues to be true. When the Lieutenant Governor and I were out at the Berkshire Regional Collaborative last week, they said the last round of appointments that they posted got booked in less than 10 minutes. There's a tremendous amount of interest in Massachusetts, as I said in my remarks, in getting vaccinated. If people continue to pursue that policy going forward into the month of May and June, we'll make a tremendous amount of progress to getting to the point where a vast majority of the people who need to be vaccinated here will be.
Governor, any date for when you might possibly think about lifting indoor mask mandate? And also, separately, any thought to giving different rules for vaccinated people versus unvaccinated going forward?
So I think the feds have basically said they're not going to get into the business of rules around vaccinated versus unvaccinated and where they can be. This would be almost impossible to do at a state level if the feds aren't going to do anything here. I do hope the feds at some point start having conversations about travel. And I don't mean like state-to-state travel, I mean international travel. I think that's going to be a really important issue for this country and for other countries to have some sort of global conversation about how travel is going to work relative to what's happening with respect to case counts and vaccinations around the world. With respect to, what was the first part of your question?
The indoor mask mandate. When would you put a date on when you lift that? Is that way far away? What's your thought?
I think the biggest question around, well, first of all, I mean, I think everybody at this point agrees that outdoor is different than indoor. And there have been a number of studies done to validate that. I think the question with respect to indoor around masks is going to be a function of both the public health data, vaccination rates, and the ongoing research that is continually occurring with respect to issues around safety and protocols. And I can tell you this, that at this point in time, we believe the vast majority of the rules that are in place with respect to masks indoors have had a lot to do with helping us manage case counts and hospitalizations, and they've been a good thing. And I certainly believe that one of the reasons why there's virtually no demonstrated in-school transmission going all the way back to August of last year here in Massachusetts has been because the schools in Massachusetts that went back in person enthusiastically adopted the rules associated with masks.
Governor, is the next big stressor for all of you as you do this reopening? And then I know you love sports analogies. Can you just Boston Marathon? Are we coming like down Boylston, Capitol Grill, or are we still on as far as on the reopening? If you use that analogy.
Honestly, I'm not sure I can answer that question, except to say that I know I speak for everybody up here when I say how grateful we are that so many people in Massachusetts have stepped up and gotten vaccinated and played by the rules for such a long period of time. We are, in many respects, a national leader on vaccines, in part because I think we built a really strong vaccination network to administer vaccines, but also because the people here in the Commonwealth wanted to get vaccinated. We did a lot of things to help move that process along, but in the end, people here, I mean, if you think about it, we have 2.4 million people who are double dosed, fully vaccinated, okay? We also have another 1.2 million people who have received one dose. And based on the current rate at which those folks follow through and get their second dose, they are going to get their second dose, which means we've already got about 3.6 million people in Massachusetts who are on track to be fully vaccinated. We continue to see somewhere, as I said before, in the vicinity of 40 to 50,000 people a day getting a first dose. Every day that goes by where that happens, you have 40 or 50,000 people who will get a second dose and be fully vaccinated. I think the trends here over the course of this have been an incredibly positive statement made by the people of Massachusetts and have made it possible for us to move to the point where we can start to contemplate getting past a lot of the rules and the regulations and the restrictions that have been in place for over a year. So I would say we are certainly more than past the midway point of this.
Governor, did I hear you say that we might be able to move up the August 1 date? It could indeed happen earlier. And what do you think it would take data-wise us to get there?
Well, the big measurements are vaccinations, hospitalizations, case counts. Those are the three big things we've been paying attention to.
Is the state's
Are you saying if the federal supply ramps up, then we could perhaps move it up?
I mean, I think it's a combination of a lot of things, but the point is we need to continue to see the kind of momentum that we have seen on vaccinations going forward over the course of the next 6 weeks and deep into the month of May, which I fully expect is possible.
Is the order,
Go ahead.
does the DPH order restricting hospital visitors remain in place, or how is that going to be addressed?
Can you speak to that?
So we have visitation in hospitals. Hospitals can obviously put some requirements in and limit the numbers, but there hasn't been complaints about other than the numbers of people who can go visit at any one time. So I'm not expecting that we're going to make any changes to the current hospital rules that we have in place.
Governor, given that the state of emergency has allowed you to put these various orders and restrictions in, with a lot of those ending August 1st, and you also have a timeline now for ending the state of emergency.
Well, obviously, we pay a lot of attention to the data that I just discussed when it comes to making decisions and making calls about what we do as an administration within the framework of that emergency order. And that's obviously one of the things that we will continue to review on a pretty regular basis based on what the data tells us with respect to where we are.
But if the data allows a full reopening, I think the state of emergency follows soon after, given it's in place for
Like I said, we're going to follow, there's a lot of pieces to this, and we're basically going to let the data drive the decision-making.
Governor, do the local boards of health have the resources to be able to do all these sign-offs on safety plans that is called for in some of these?
They've been doing the sign-offs on the safety plans for about a year. I think the long story short here is there should be less of them when we get to the point where it's DPH issuing orders under its existing statutory authority and local boards of health operating within their existing statutory authority than what we've been doing for the better part of the past year, if I understand your question.
Well, a lot of businesses still have to submit a local plan, the way our written release, they have to submit a local plan. This is what we plan to do for this reopening.
Yeah, I think there will be less of that.
Governor, you sort of shied away from doing anything about what you said today, setting rules on what businesses and corporations and everybody can do about permitting vaccinated people only to come in. So does that mean companies, Fenway Park, they can do whatever they want without any regulations?
No, what we've said all along here is whether you're vaccinated or not is less important to us than the nature of the venue that you're talking about or the place you're talking about and what the rules are that exist for that particular place. So whether you're vaccinated, if you go to Fenway Park, whether you're vaccinated or not, we're going to expect you to wear a mask and socially distance, period.
That's not my question. My question is if businesses and venues and what have you, as we get closer to that August 1st day, if they say we only want vaccinated people here, you said...
They have the authority under existing state law to make that decision.
Can they do that right now?
Yeah, they probably could.
So why not build some consistency? You sort of suggesting you don't want to get it. That's the Fed's responsibility, and they should get involved. Why? Everybody could have their own rules.
Look, I fully expect that as this moves forward, you're going to see businesses make a lot of different decisions based on the nature of their business, the nature of their customer base, the nature of their employee community, and the nature of the way they feel about all of this stuff. People are going to make different kinds of decisions about how they're going to handle this. I mean, I've talked to some businesses who've said that they're not going to require everybody to come back, but if you want to go back, you're going to need to be vaccinated. And if you do come back and you are vaccinated, then there will be a set of rules that will either be built off the ones the Department of Public Health already has in place, or others that will determine the way those offices operate. I think that's the appropriate way to do this. I don't think we should do this with a one-size-fits-all. I think we should let employers, let businesses based on let organizations based on the people they serve, the folks who work for them, and the nature of whatever the particular concerns they might have about spread and about COVID drive the way they make decisions about how to handle that stuff.
Do you still have reservations about vaccine passports, or what if that becomes the norm?
Say again?
When it comes to vaccine passports, the last time I asked you, you mentioned it could be seen as a barrier for some. What if that becomes the norm or more widely used in the private sector? Do you still see issues with that, or has your stance changed?
I don't understand the question.
How do you feel now about vaccine passports?
Passports?
Yes.
Okay. I thought you were asking me about a vaccine task force.
No.
Okay.
Has your stance about them
No, my stance has not changed. I don't think, I think if the feds want to put some sort of structure in place that operates at a national level, that's their call. But if there's not going to be a national strategy, I don't think states should be doing this one at a time.
What is
you get a
the
second
plan
shot
for
on
the
it?
state's workforce?
Pardon me?
The plan for the state's workforce, you talk a little bit about how private businesses can make their own decisions on whether or not to have people back full time. What's the plan for the state?
Well, keep in mind that a lot of people who work in state government, like in many cases in private businesses and in municipal businesses, need to be at work. It's pretty hard to operate a lot of the sort of core functionality of state government without people actually going to work. And we've had rules and protocols and standards in place since the beginning of the pandemic for those folks. I would expect that at some point over the course of the summer, we will move to more people being, quote unquote, back in the office, back at work, but it's probably going to be in some sort of a hybrid type model.
Governor,
Did you get your
it is,
second shot yet? Was it scheduled?
Nope, later today.
Governor, it's crazy to me that it was May 18th when you guys announced this reopening plan. Now we're here almost a year later. I mean, is this a huge sigh of relief for you, or any reflection or thoughts of just being here at this moment, announcing maybe the light at the end of the tunnel?
I guess I would say that, and again, I know I speak for everybody up here, that we all know how hard this year has been because our phones and our emails and our written correspondence that we have gotten, along with the thousands of conversations we've had with people, have made very clear to us how hard this year has been on everybody. And I also get the fact that in many cases, a lot of these decisions that we needed to make based on the data that was available were destined to make lots of people unhappy. And that's why I think I said earlier, we are so grateful that people here in the Commonwealth want to get vaccinated, want to solve this problem, want to put this thing behind us, and know that the fastest and best way that we can all participate in making that happen is by getting vaccinated. The people in Massachusetts have been incredible every step of the way in terms of their flexibility, their resiliency, their creativity, their support for one another, their willingness to make clear to us about what they don't like about what we do, which I also appreciate. We learn a lot from that. But especially around this vaccination issue. I talk to other governors all the time, all right? And many of them would give anything to have the same level of excitement and enthusiasm and commitment to getting vaccinated in their states that we see here. It's an incredibly powerful piece of momentum, and I hope it stays with us because it will help us ultimately turn the corner and begin to think about this in a very different way. And I think I think I can speak for these folks, because I know I speak for a lot of people in Massachusetts. This has easily been the longest year of my life. And I think for a lot of people, it's been the longest and most difficult, and in some cases, the most brutal. I take tremendous, I can't tell you how grateful I am that my dad survived this whole thing. Because that sure wasn't true for a lot of other people. And I got asked in one of my interviews with somebody, I got asked, well, what's the first thing you want to do when things are like totally back to normal? I said, I want to take my kids and my wife and go to a concert. That's what I want to do. But I don't want to do that until we get to the point where that can be done in a way where people people won't be putting one another and each other at risk by virtue of doing that.
Governor, you mentioned that you're hoping more state workers come back. Do you require them to be vaccinated?
I don't think we're going to require people to be vaccinated, no.
So your position might be different from a private business?
Correct.
And what's your rationale for that?
Still a free country the last time I checked. And my company, our company, the executive branch of state government, is a lot different than many other businesses in Massachusetts. Do we have hundreds of thousands of businesses? We certainly have tens of thousands of businesses. I think we have hundreds of thousands. We have hundreds of thousands of businesses of all different shapes and sizes that do all kinds of different things that are spread across 351 cities and towns. The idea that we should have one set of rules for all of them as we come back out of this thing just doesn't make any sense to me at all.
Governor, would you encourage municipalities to start opening their buildings back up along 60 towns? Town offices are so close, they're not accessible. Do you think that fits into the reopening process?
I mean, I would hope that as more and more people get vaccinated, local communities would be able to figure out a way to get that done. I voted today in Swampscott, and I didn't get to vote across the street at the church, which is where I've normally voted. I had to go vote at the high school. And they did a really great job of sort of figuring out what the safety protocols and the process for voting in person would be there. And I think, again, we have 351 cities and towns. They're very different in terms of how they're organized, what resources are available to them, and how they would go about deciding the best way to do their work. But I would hope and anticipate that if we continue to make the progress we've been making, I would hope to see more and more people in a position to feel comfortable that they can open up their front door. Yeah.
Did you get your second shot?
Scheduled for tomorrow, the second shot.
So when you, when you deliver 2.4 million second doses, right? That's how many people are fully vaccinated here. We all hear from, I haven't heard from all 2.4 million, but I've heard from a lot of people. And honestly, the distribution with respect to, nothing at all to, flat on my back for 2 days to the sore arm or somewhere in between, I don't think there is like a standard response that people have to this. And I'm obviously going to play it by ear, but I'm really glad I'm getting my second shot, because that means 2 weeks from now I can hug my dad, which I haven't done yet. So, thanks.
Thanks, everyone. Thanks, guys.
Gonna go to a ball pit?